What's up, listeners? Our Health Highlights series continues with three more leaders who spoke to us at the health conference in Las Vegas. We asked leaders how they're seeing the consumer point of view being incorporated to bridge the gap between traditional sick care and consumer-based well care. Today's episode focuses on employee benefits, wellness, and primary care. So you'll hear from Dr. Jon Van Der Veer, founder of Hy-Vee Health Exemplar Care, Dr. Erica Armstrong, founder of Root Functional Medicine, and Jason Campana, CEO of LifeSpeak. Let's get into it.
Give your name and title and kind of what you're all about.
Dr. Jon Van Der Veer. I'm an internal medicine physician by training. Started what is now Hy-Vee Health Exemplar Care, a direct primary care clinic in Iowa and the contiguous states around there.
How does that work in terms of Exemplar Care and Hy-Vee, like the partnership?
So Exemplar Care started and Hy-Vee became interested in it for using it for their own employees and are 50% owners. And then two other gentlemen and I own the other 50% and have operational control.
When was that? Like, when did that happen?
January of 2024. So we're about a year and a half, almost 2 years into this partnership.
Okay. Any highlights from that time? I know a lot's happened, a lot of growth's happened since then.
Yes. So we went from 3 clinics in the Des Moines Metro, 2 when we first started talking, and we've got 13 now with about 10 more planned for next year. So we're in now 5 states, and each new market brings in interesting challenges, different dynamics, but the direct primary care model kind of sticks through all of them.
What's the newest news you want to share with our listeners in terms of what's going on?
So one, we are ready for open enrollment to get ready to launch with Hy-Vee Health with Oscar, which is a partnership with Oscar Health out of New York. In the Iowa market for 2026, we're going to be launching one of their ICHRA products, and it's going to have DPC built into it. So we don't do any of the insurance stuff just like a regular DPC wouldn't, but the individuals who come in will have $0 visits, $0 copays. They'll get meds, labs, imaging, all the usual things we provide a DPC person. And then they have their insurance built in on the background. So they have catastrophic care. They have a deductible that they go through, and they have a heart attack and they didn't do the preventive things that they should be doing. They're going to have an insurance product that's built into it. We are on the verge, and I'm not going to say who, but we are going to be announcing, partnering with an agentic AI company that's working on how you get consumerism kind of the front end to the back end and the experience for the patient on how they interact with us. So really excited about that. It's not quite there yet.
Fantastic. You're talking about bringing together a lot of different areas of health and wellness that we've been trying to tell the story of on this podcast, which is we use the word consumer a lot just because it's easier than saying you're not a patient all the time.
Yep.
So in those times when you're not, sometimes when you are, but all the times when you're not, you're still making health and wellness choices every day. And the comfort level and the trust you have in what to do, either when you get sick or you're trying to improve your health in any way, that level of trust and confidence can be so low because of either our previous experiences with the healthcare system or we don't know how to navigate the information we're getting. So that's kind of where we're coming from on things. Is that who's the typical person, that benefits the most from a model like what you have here?
So that description you just gave of no one trusting the system anymore is really why we do direct primary care. Physicians, NPs, PAs practicing are all burning out. This gives them a different, refreshing model where they get to spend time with people, actually build relationships, so that trust is built. Because without that trust, again, you make less informed and less good decisions than you would be. So in this model, you get that relationship, and then you're able to text somebody. You can message them on a portal. You can just pick up the phone and call them and have a conversation about those things that are on your mind. And most importantly, all the hurdles come out of the way. So you don't pay anything when you come in. You don't pay for your labs, your imaging, any of the services we provide as a primary care clinic, and we also have urgent care built in with it. So you're not going to get a surprise bill. You're not going to avoid doing things because it's a system you don't trust. You don't know what's going to happen. All of those pieces are kind of wiped out, and it becomes old-fashioned healthcare. You just take care of people, and the consumer has been choosing it, and I think you've seen it grow across the entire country on this model for direct primary care and having that relationship.
For those who aren't as familiar, we're asking a consumer to bridge two worlds themselves, what they're getting from their clinical care team and what they're hearing and seeing everywhere else.
Yes.
From people they know or content, social media, wherever the channels are. People are trying to figure out what that is. So how do you help them bridge that gap?
So I think we become an additional resource that they can bounce things off of. I have conversations with people who come in, hey, I heard about these GLP-1s. I want to be on Ozempic. Like, why should I do this? Why shouldn't I do this? I've read all these different things. And then having the relationship, they're bringing those questions in and they're actually having them answered by someone who cares about them instead of whatever clickbait is going around, whatever's on social media. the good, the bad of any health trend, whether it's something like Ozempic or if it's something more controversial. It gives people a relationship to have that conversation. And I encourage people, go out and learn all these things on your own. Learn about what diet is best for you, which one's working for you. There's a thing called N of 1 trials, where if it works for you, Jared, and nobody else, who cares? Keep doing it. So I challenge people to bring in, like, hey, here are ideas to kind of challenge the dogma. And I've learned these things from the internet. Okay, bring them to me and let's talk through them. Let's see if they're the right fit for you.
It's really refreshing. I just have to say, instead of just shutting down that conversation right away and saying, don't trust any of that. In some instances, it's true. The information isn't worth trusting.
But you better than anybody else.
Exactly.
You're the one that it either is or isn't working for. And people like hearing that. Like, oh, I'm not doing something that's going to harm me. Okay, it doesn't help me.
Exactly. And it's a very different conversation all the way around. So fantastic. John, what trends are you paying attention to? Either maybe they have to do with what we've been talking about so far or they don't. But like, what's in the middle of your radar screen these days?
So it's really become evident in the last, I'd say, 3 years that people's diet, their exercise routine, and their sleep patterns are the three-legged stool that you have to have for your own health and nutrition, which everyone knows medical students don't get much education in this. This is something you have to go out and really want to learn about to have informed conversations with patients, because there are plenty of patients who I would say are now smarter than some of their clinicians because they've dug into it and really learned this stuff. So I think the exercise, nutrition, and sleep studies and information coming out are really impressive. Then obviously you can't have a conversation, especially here, that doesn't include AI. And it's really interesting. I had a patient, and this is, I say I don't know a lot. When someone asks me a question, I don't know. A gal came in and she said, I have sweaty feet. They feel sweaty, but when I touch them, they're not sweaty, but they feel sweaty, and it's driving me crazy. And I said, I have no idea. We're going to have to look this up. I said, I'll do some homework. And I was using ambient AI, so it was listening to this conversation. I said, all right, we're going into, I think it was ChatGPT 5.0. And I said, you're a world-class dermatologist, and you have a patient who showed up. Here's their age, all this stuff. What is the differential diagnosis? What's the most likely cause of this phantom sweaty foot sensation? And it spit out an amazing summary. It's my job then to say, okay, is this valid or not valid? Like the information in it. And it came up with things I'd never heard of. It was fantastic. And I said, the takeaway of all of these is none of them are concerning. There's nothing you have to worry about. This is going to improve with time, and we'll follow up or whenever she wants to.
Great example. These examples are happening every day, aren't they? I mean,
every day.
Yeah.
It's crazy. Do I have time for a quick story on this?
Of course.
So I was sitting at dinner at a DPC pre-conference meeting, and it was a family practice doc across from me. I'm an internist and a pediatrician next to me, and then a state health plan CEO catty corner from me. And the pediatrician's father-in-law was having some abnormal labs, and so the three of us were talking about, it could be this, and this. And the CEO goes, well, according to this prompt I just put in that I've been using, what about this? And then he brought up glucocorticoids, steroids. And we all said, oh, yeah, he got steroids not long ago, and that causes this blood abnormality. And so 3 board-certified physicians were just run over by a CEO of a health plan who had an app that's smarter than all of us combined. So I think it's really, if you're avoiding it from the clinical side or from the consumer side, you're missing out. Yes, they can have hallucinations, but if you have informed people, just like we used to sit and go through other research, like these things have references, look at them, see if they're valid, and move on and adopt the behavior. So really cool stuff.
The conversations are happening, but for us to be able to point to them and say, like, yeah, here's why that worked or why it didn't.
Ashamed of that something that reads every book ever written has more knowledge than we do. That's okay.
John, what else haven't we talked about that you want to make sure our listeners hear from you? Or
I think we were talking about before we started, paying attention to the healthcare systems debate that's going on right now around the government shutdown, really paying attention to how is care paid for? Is there a price? Can you figure out that price? All of those different pieces, and really trying to figure out, okay, it's not about subsidies or not having subsidies. It's about lack of transparency, not knowing prices, not being able to adjust for cost. And all of this is just a shell game that people are moving dollars around, and they're your dollars as a consumer. So how do we start to shed some light on that during these tough conversations that look very partisan and angry, but are really just conversations we as a country need to be having?
Fantastic, John. Thanks so much for joining us and for
Thank you for the opportunity.
Adding to this conversation.
Great. Thank you.
Erica, it's good to see you again. When we had you on the podcast just earlier this year, there was a lot of excitement around what Root had been doing up to that point, and Root has been very busy since then. Maybe we can start with kind of what's been happening the last few months, especially recently, and how Root has been expanding.
Yes, I'm so happy to be back on your podcast. Thank you for having me. Last time we spoke, we were launching our direct-to-consumer lab testing, screening, and membership where people can get their labs drawn for a full body testing, and they can receive insights and recommendations on our platform from that, but they can also work with doctors and dietitians one-on-one via telehealth. And since then, we've really embraced the B2B space. Root has become an important employee benefit that layers right on top of existing employee benefits for a number of reasons. One, to give people that functional medicine benefit that's otherwise very difficult to access. And two, to be more proactive, enabling the whole body lab screening so we can have early detection and intervention of conditions. And lastly, because everyone knows that healthcare costs are out of control. And actually, functional medicine is a great way to control those because we target what causes 90% of healthcare costs, and that is chronic conditions. So we get in there, we put the whole picture together, find the sometimes one or two things that are driving a lot of the chronic condition symptoms, and we give people a clear plan to guide them forward to start to reverse that.
I love that. It's really right at the center of the mission of our show, which is bridging that gap. I'm finding in a lot of our conversations, we first had to have these services available, and now we have to show people how awesome the services are, essentially, right? Like we have to work through people who didn't have a good experience the last time they encountered a healthcare situation, whether it was with their primary care provider or not. It's working through a lot of situations of just somebody understanding how they can trust this new service or a new provider or a new program or subscription, whatever it is. They're incredible new services now, and it's just helping people understand that. What's been your experience so far in helping? Maybe we can start with employers. Like how do you help them convey the value of your approach?
Yes, and it is helpful that we've been working direct to consumer for a couple of years before we really got into the employer space, so we can really speak to that individual member experience that their employees will experience. As far as, talking about the value, a lot of the times the employees have already done that for me, which is really exciting. Some of the inbound inquiries that we get are because in their employee surveys, they're looking for functional medicine to be added to their benefits. So that's always great when I don't have to kind of sell that, yes, your people will engage. They're looking for this. This is what they're spending money on outside of the health plan already. So it's a great way to keep your employees happy and well and provide something that they're already using, but in a more cost-effective way, in a more scalable way.
Are there some who understand what functional medicine is more than others? Like when it comes to, again, I guess conveying the value of it, are you able to guide people along the lines of like, here are the benefits of this approach?
Yes. I guess we should probably start by defining that because some of your audience might not know what functional medicine is. And so we define it as looking for and treating root causes. That's why we're called Root Functional Medicine. And to do that, we do more testing because we're looking for why. But that's just a part of it. I think the other biggest part is that our team of doctors and dietitians, they have a lot of experience. They were trained in the primary care fields. And when you train in like family medicine or internal medicine, you rotate through every single specialty. And so you're trained in all the areas. And instead of the conventional system where each specialty is its own silo, like the body systems don't interact, functional medicine puts the whole body together and understands that body systems do communicate and affect one another. And so that putting that complex picture together does take a nice background like that. And then the second piece of that team is the dietitian, who actually is the driving force of a lot of the great changes that our people make in laying out clear nutrition recommendations and following through with continuity.
I've really enjoyed getting to know that part of what Root offers. It was kind of one of my first introductions to functional medicine on a broader scale of what's possible. I can say, I'm on my own healthcare journey, right? Like I'm trying to understand a lot of those things about, my own health and what contributes to what. And it's just challenging what I assumed or thought I knew about, what leads to better health or worse health in my own case. So I'm a fan of the approach, you can say that. And I do think that that's part of a greater conversation about how do we make healthcare more about the individual who's being treated, especially during the times in between patient visits. And I do think that's another part of your approach that's helpful there. How do you keep someone engaged? I mean, we use the word consumer a lot, on the show just because we're trying to represent that time when you're not actively a patient. And yet it's more of like a person, versus a consumer. Like, what have you found to be successful there in terms of engaging people in between and help them kind of on that journey?
Yes, well, similar to you, Jared, we have a community and a platform, and our members, we say this pun intended, but they root for each other. They do.
There you go.
And our dietitians are in there as well, answering questions. So people do still feel connected, and we have tons of resources on there. So instead of using Google, you can look on Root's vetted content, everything made in house, and our protocols and our meal plans. They're all there to support people in between visits.
And are there particular aspects of your model that you want to do even more of, or kind of expand from here?
We would love to add more and more employers. They're growing fast this year, the number of companies that we're working with. We find it truly uplifting to get in and see this change in community, the community of the company. And, your habits are similar to those that you're around a lot of the time. And so getting in and changing the whole company's health and behaviors is an effective way to do that.
What's kind of your vision here? If things keep growing, things keep going well, what do you hope Root will help accomplish?
I hope that Root is a benefit for every self-funded employer in the U.S. because it makes sense to layer us right on top of existing benefits to make your people happy and control costs at the same time.
Pretty simple there. Erica, anything else we haven't mentioned or anything else you'd like to share with our listeners, either along those lines or anything we haven't talked about yet?
Sure, yeah. If you want to learn more, just head to rootfunctionalmedicine.com or follow us on LinkedIn at Root Functional Medicine.
I'll vouch for that, listeners, in terms of the value there. It's and the podcast itself, you want to mention? Yeah.
Oh, yeah. How could I forget? Yes, we do have a podcast. It's called Get to the Root.
And it's worth listening, folks. Check that out. Assume that's on all major podcast players, Apple, Spotify, and everywhere else where you subscribe. So check that out. Erica, it's been such a pleasure. Glad we got to do this, and love to keep chatting as we see the success the Root has going from here. Thanks for joining us.
Well, thank you so much.
Jason, thanks for joining me and telling me a little about your work. What's the latest news from LifeSpeak that you'd like to share with our listeners?
We have a few recent updates that are exciting. So I've recently been named as CEO of LifeSpeak following a take-private transaction that we closed on at the end of June, which brought in $50 million in new funding to help us advance, our strategies in the market. We're very excited about that.
So what's been standing out to you here at Health? What have you been seeing and hearing?
Well, the dominant theme to me has been, obviously we're trying to quell healthcare costs. They're spiraling out of control, and everybody here is trying to play their part in solving some of those challenges. To me, it feels like, as somebody whose solutions are focused in the preventative space, it seems like a lot of the energy and focus here is still on kind of the crisis piece, where the costs are happening and how do we reduce them at that point. And I would say it seems focused too much on the lagging indicators, what we're seeing, instead of the leading indicators.
What are some ways that LifeSpeak is looking to address that gap? Because I agree, that's one of the biggest challenges in this space.
Yeah, we focus on what we like to say is the other 364 days, when a human is just trying to navigate the challenges of life and they need help and support. So we show up and we have solutions around parenting and caregiving, fitness, nutrition, mental health education, as well as substance use management, to help people when they are just trying to get up and be a little bit better today than they were yesterday, and start to develop habits that will lead to healthier behaviors, allow them to show up a little bit more present to work, and be a better father or mother, and ultimately take better care of themselves along the way.
Yeah, I respect that because you're talking about people as people, not just as patients that one day a year. How do you use that point of view or keep it front and center with what you do? Because at the end of the day, you're helping individuals navigate a life experience.
Well, what we're trying to do, so our primary access point to end users is through their employer. And, we try to connect. Employees aren't looking for their employers to constantly be talking to them about the healthcare costs and, how expensive it is to support them as an employee. They're looking for their employer to show up and care about them as a human and, relate to them with stories. I mean, what I'm talking about, and when I engage with people telling my own story, just about how I'm navigating life as a father, as a coach, as a husband, as a caregiver for my aging parents. I mean, these are relatable things that people are going through. And if we can connect with people in that way and then provide them with the tools that they need, they feel supported. And when people feel supported, the whole paradigm starts to change and they get confidence again and they can focus on the small changes that they need to make, again, just today, that will lead to bigger changes over time.
Yeah, that's great. How else do you personally think we can bridge that gap between what happens after we're sick and what happens those other days of the year when we're trying to prevent ourselves from feeling unwell?
I mean, there's a lot of really great innovation happening here. AI is obviously going to play a big role in that. The more personalized we can make things for people, there's a lot we can do. Even if somebody gets to the point where they're in crisis and they need a medical intervention or they need to be speaking with a clinician, it doesn't mean that has to be the path from that point forward, right? There's still a lot. These are preventable conditions in many cases, and there's a lot that we can do to introduce the habit-forming tools and resources, behaviors that can help somebody get off of medications if they find themselves there, or reduce weight if they find themselves, needing to rely on GLP-1s. And I think that's going to be key for us as an industry, is to work that back when you end up in that point of crisis. How do we get you back to the point where you don't need to depend on the healthcare system for that care?
That is truly a vision of what we hope will happen as we continue to see progress in this area. Anything else you'd like to share with our listeners?
No, I think it's been inspiring to be at Health and seeing the energy that people have for this space. I think this is going to be a period of incredible innovation over the next handful of years. You can already see it starting. And as people start to figure out how to use the technology, everybody's kind of feeling their way around right now, but it's going to be really amazing. I think the next 10 years for this industry and what we're going to be able to do will be a lot of fun to be a part of. I'm certainly thankful to be leading a company that's trying to contribute in their own way. It's been fun to be a part of the event.
Jason, we appreciate your perspective. Thanks for joining us today.
You bet. Thank you.